The Nigerian Medical Association (NMA) has called for the establishment of a unified national benchmark for healthcare workers' remuneration as part of efforts to address the Japa syndrome and halt the mass exodus of medical professionals from Nigeria. This was one of the key resolutions reached during the NMA's third National Health Summit and December 2024 National Executive Council meeting held in Abuja from December 2nd to 6th under the theme Healthcare Delivery in Nigeria, Translating Policies to Impact. Reading the communique at the summit's conclusion, NMA President Professor Bala Awudu emphasized the urgent need for a standardized pay structure across all levels of healthcare institutions. He highlighted how wage disparities have fueled internal brain drain, with doctors leaving local government hospitals for better paying state or federal institutions. The proposed benchmark, he said, would stabilize the workforce and ensure equitable distribution of medical professionals nationwide.
Ensure that every qualified registered doctor who is licensed by the Medical and Dental Council of Nigeria has a minimum remuneration benchmark that you cannot go below, whether the individual is employed in the public sector or in the private sector. Even in the public sector, whether the individual is employed by federal, state, or local government. And even within those sectors, whether the individual is employed in a primarily health sector, like hospitals, or in other departments and agencies that require the services of a doctor, such as university lecturers who are doctors, such as customs services who employ doctors, such as security agencies who employ doctors. Everyone must comply with that minimum benchmark.
Professor Awudu urged the government to reduce the cost of medical supplies and imports to achieve affordable healthcare for all Nigerians by 2030.
The whole essence of universal health coverage is to ensure all Nigerians who need health care are able to access the best quality, patient-centered and respectable care. Access that care without undue financial difficulties. We must mitigate and reduce out-of-pocket expenses by ensuring that insurance health coverage is spread across all Nigerians.
Thereafter, he advocated for strict standardization and quality checks across healthcare facilities to meet patient needs for acceptable global standards.
To provide primary health care, there are standard guidelines for the kind of infrastructure, number and mix of healthcare providers, essential medication standards on the kind of diagnostic facilities, how quick you must refer patients to the next level of care. That certification is not in place yet.
Awudu dismissed rumors of a new COVID-19 variant in Nigeria, assuring NMA's readiness for health emergencies and ongoing effort to strengthen crisis response.
The Nigerian Medical Association have standing teams that are ready to handle medical emergencies.
NMA President Professor Bala Awudu announced plans to finalize a minimum pay standard for healthcare workers, urging support for reforms to improve welfare, ensure quality care, and strengthen Nigeria's healthcare system. Vincent Okushin, QTV News, Nigeria.